Today I want to share with you how fear, in some instances, can prevent parents from advocating on behalf of their newborn who has suffered a traumatic brain injury like HIE. I'm going to give you a couple of examples as to how this can manifest itself. So some quick background about me. I am a birth injury or a birth trauma attorney, and what that means is I help families find answers as to the cause of their baby's traumatic brain injury at birth. And if it's a hospital or if it's the doctors or the nurses, if they are responsible, I help them take action and hold them responsible for causing the injury. So in my practice, I speak with a lot of parents. I speak with a lot of families. People contact me just even on this app and other apps and, online and call in my office. So I talk with a lot of families about this. And what I've been able to find out in talking with them is how fear can make its way in this process. And having some fear is okay. That's fine, because what some fear can do is it can cause us to be a little cautious. It can cause us to analyze before we take action. But this is when fear can be bad. When fear just consumes you to the point to where it essentially creates paralysis for a parent or for a family, that is when we can have problems. And this is not just from the standpoint of, not wanting to reach out and contact someone like myself, but it can also hurt in other areas. For example, if your child needs a second opinion or you need to speak with another medical professional about what's going on. I've talked to parents before in which they've told me that essentially they didn't want to speak with that other professional because they were afraid, they were fearful of what that expert was going to say, whether that expert was going to confirm the diagnosis or say something else that was essentially to them going to be harmful for their child. And so that fear was preventing them from being able to move forward. Now, yes, there's a chance that that expert is going to confirm, but there's also a chance that that expert may not confirm. That expert may see something else or may have other diagnostic or other types of treatment options. So again, you will not know any of these things until you take action and ask or go ahead and take action to talk with that second opinion doctor. It can also manifest itself when it comes to asking questions of the doctors. So sometimes when fear has just taken a deep hold, it will paralyze the parents when it comes to asking questions, and they may not drill down more when the doctors are answering questions, or they may not tell the doctor, look, I'm not understanding what you're saying. In other words, it doesn't allow them to take further action when it comes to asking questions and getting answers. And that's really the bulk of this video. When fear gets to the point to where it is just preventing action, it's causing paralysis, that's really not good for anyone. What I would like to suggest is that if you are going through this, if your baby has suffered a traumatic brain injury and you are fearful, what I would say is take small steps. No one's talking about trying to have it all figured out tomorrow. That's impossible. You can't do it that way. Take small steps. Maybe, start researching your second opinion doctors. Go ahead and start making a list. Not saying you got to call anyone right now, but maybe you can start making a list. You can go on Google or whatever, search platform and start looking. Or maybe you were given a name and you are afraid to speak with that doctor. Maybe do a little bit of research on that doctor first. Maybe look at some reviews, look at some literature that the doctor has done. In other words, taking small steps a lot of times ends up turning into big steps. And once you started taking more and more steps, the fear aspect begins to go down. And it's going down because you are taking action. You're educating yourself about whatever it is going on. You're having a better understanding. And action is a serious enemy to fear. If you have more questions, maybe you are here watching this video today because you have started taking some action, small, but some action. And if you want to speak with me further about what's going on with your child, maybe your newborn has an HIE diagnosis, or you just had a really challenging labor and delivery, and maybe your baby now has seizures and you don't know, or maybe they've had to have the hypothermia cooling, or maybe you're past that and your baby has a subsequent cerebral palsy or CP diagnosis. If you have that going on, like I said, telephone number on the screen, go and pick up the phone and call me. I talk with families like yours all the time about these types of issues: HIE, hypoxic ischemic encephalopathy, meconium aspiration syndrome, seizures, shoulder dystocia. This is what we do. When you pick up the phone, and remember, it costs nothing to talk with me about what you got going on with your family. When you call my office, be sure to let my secretary know that you would like to get on our calendar, pick a date and a time that is important, a date and a time, so we can know when to call you back. But just make sure that you take that action. If you are not in Maryland, I want to say this before I get out of here, if you're not in Maryland, because I practice law in the state of Maryland, just understand that we have to use what we call co-counsel or local counsel. In other words, an attorney in your state. And that's something I just want to make sure that you understand, that local counsel aspect of things, if you are not in Maryland. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here in the state of Maryland at Boston Law Group, LLC. We'll talk with you next time. Take care. Enjoy the rest of your day.